Okay, I must mention that as of now, there is no reported case of Ebola in Nigeria. And honestly speaking, there is no need for panic, as has been said by NCDC. However, that is not to say that we must not take precautionary and proactive measures to ensure that, whatever happens, at least people are not infected and the transmission is there. So those basic things that borders on infection prevention and control must be, implemented at this point in time, either at the level of the hospital or in the community, particularly hand hygiene, hand washing. This has been one, of the most, effective infection prevention and control measure practices that has been found to, prevent transmission of infection in about 90% of cases. So Nigerians should, do more in terms of washing their hands, regularly, because this disease, Ebola, is a disease that is transmitted by contact with secretions, from either infected individuals or individuals that might have died of the disease. Secretions including blood, feces, vomitus, and all other body secretion, even organs. So it's even on surfaces that some of these secretions have actually made contact with, one can actually get that from them. So it's important that we heighten our hand hygiene practices and also ensure that cough etiquette, this is not the time that people should just cough anyhow and throw those sputum. There are appropriate ways to make sure that all these things are done in order to. Then in addition, I think there is also need for government and relevant agencies to heighten public awareness, public health education, creation of awareness, and so on and so forth is very important, because in 2014, that really helped. The community engagement really helped. Public health education via radio, and all one-on-one with community leaders, religious leaders, really helped in helping to contain it. I think we must begin to look at those things that gave us that success story in 2014 and bring them back. Because we have to leverage the existing infrastructure and everything that was done then that was able to help us minimize the fatality rate associated with the disease. So hand hygiene, major infection prevention and control measures should be implemented at this point in time so as to be able to, contain it.